Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Lymphedema. Introduction. Lymphedema is the buildup of fluid in the body's tissues when the lymphatic system is damaged or blocked. The lymphatic system carries fluid called lymph throughout the body. Lymphedema has many possible causes. Treatment includes physical methods such as compression stockings and medicines. This program focuses on lymphedema. It discusses what it is and what causes it. It also covers symptoms, diagnosis, and treatment. The lymphatic system. The lymphatic system is part of the immune system. The immune system fights infections and other diseases. The lymphatic system is made up of lymph vessels, lymph, and lymph nodes. Lymph is a nearly clear fluid that drains waste from cells. It travels through the lymphatic system, which is made up of channels and bean-shaped structures called lymph nodes. Groups of lymph nodes are found in the neck, underarms, chest, abdomen, and groin. Lymph nodes are connected by special channels called lymph vessels. These channels are spread out over most of the body, like blood vessels. The lymphatic system drains excess fluids and waste. Other parts of the body also contain lymphatic tissue, including the tonsils, thymus, spleen, stomach, skin, and small intestine. Symptoms. Lymphedema usually causes swelling in one arm or leg. Sometimes it may affect both arms or both legs. The fingers and toes may also become swollen. The swelling caused by lymphedema is called edema. Other common symptoms of lymphedema include a feeling of tightness when wearing clothing, shoes, bracelets, watches, or rings, a heavy feeling in an arm or leg, a tight feeling in the skin, trouble moving a joint in the arm or leg. Lymphedema may also cause a burning feeling in the legs, itching of the legs or toes, loss of hair, repeated infections on the affected limb, thickening of the skin with or without skin changes such as blisters or warts, trouble sleeping. Symptoms of lymphedema may happen very slowly over time. If there is an infection or injury to the arm or leg, symptoms may appear more quickly. Severe lymphedema can affect daily activities and the ability to work or enjoy hobbies. You should make an appointment with your healthcare provider if you notice any signs of lymphedema. Early treatment can usually prevent the swelling from getting worse.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Lymphedema is caused by the accumulation of lymph in body tissues. When part of the lymphatic system is damaged or blocked, lymph cannot drain from nearby body tissues. If lymph cannot drain through the lymphatic system, fluid builds up in the tissues. This causes swelling called edema. The lymphatic system can develop abnormally and cause lymphedema. The lymphatic system may be damaged by infection or injury. It may also be damaged by cancer and its treatments. Some treatments of cancer that may cause lymphedema include radiation to the affected area, removal of lymph nodes, surgery that affects the lymphatic system and causes scar tissue. Lymphedema can develop within days or many years after these treatments. Lymphedema often happens in breast cancer patients who had all or part of their breast removed and surrounding lymph nodes removed. Once these lymph nodes are removed, it is harder for lymph to drain from the affected arm. Lymphedema in the legs can happen after surgery for uterine cancer, prostate cancer, lymphoma, or melanoma. It may also happen with vulvar cancer or ovarian cancer. Diagnosis. Your healthcare provider will first ask about your medical history and symptoms. He or she will also perform a physical examination. If you are at high risk of lymphedema, your healthcare provider may make a diagnosis based on this information. An example would be if you recently had surgery to remove lymph nodes. For some people, the underlying cause may need to be investigated further. Swelling can have many different causes. Before diagnosing lymphedema, your healthcare provider may want to rule out other causes of swelling, such as blood clots. A lymphoscintigraphy is a procedure used to make pictures of the lymphatic system. These pictures can show if there are blockages or if the lymphatic system is damaged in any way. A safe radioactive substance is injected to make the lymphatic system easier to see. Other imaging tests, such as MRIs or CT scans, may also be done. Doppler ultrasound can be helpful in finding or ruling out blood clots as a cause of swelling. A Doppler ultrasound uses sound waves to look at how the blood flows through the vessels of the affected area. Other tests may also be used to rule out other causes or to look for an underlying condition that may cause lymphedema. Treatment. There is no cure for lymphedema. However, treatment is available to reduce swelling and pain. You can reduce swelling by keeping the affected limb higher than your heart while sitting. You should also avoid sitting or standing in one position for too long. Avoid wearing tight clothing or jewelry. When clothing or jewelry is too tight, it can prevent lymph from draining properly. Light exercises may help reduce the amount of swelling caused by lymphedema. A physical therapist can show you exercises that will help lymph drain out of the affected arm or leg. Symptoms of lymphedema may also be reduced using a massage technique called manual lymph drainage. Manual lymph drainage gently moves lymph to healthy lymph nodes. The healthy lymph nodes can drain the lymph. Wrapping an affected leg or arm with a bandage can encourage lymph to drain and reduce swelling. Start at the fingers or toes on the affected limb and work your way toward the trunk of the body. Wrap tightly at first, getting looser as you move up the limb. Support stockings, sometimes called compression stockings, can also help treat lymphedema. Support stockings keep fluid from collecting in your legs or arms by putting pressure on them. They are available at most drugstores. Another treatment for lymphedema is pneumatic compression. Pneumatic compression involves wearing a special sleeve over the affected limb. The sleeve is connected to a pump. The pump inflates the sleeve every so often to move lymph out of the arm or leg. Lymphedema can sometimes lead to infection. If infection develops, it is often treated with antibiotics. Not all treatments for lymphedema are right for everyone. People with diabetes, heart failure, paralysis, or infection may not be able to use some of these treatments. Talk to your healthcare provider about which option is best for you.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Lymphedema is the buildup of fluid in the body's tissues when the lymphatic system is damaged or blocked. The lymphatic system carries fluid called lymph throughout the body. Lymphedema can be caused by abnormal development of the lymphatic system. It is also caused by other conditions or diseases that damage the lymphatic system, such as cancer and its treatments, infection, injury. There is no cure for lymphedema. Treatment includes physical methods, such as compression stockings, and medicines if an infection develops.
Thank you for using Explain.